I just want to wrap up with a couple of comments. We've talked today about multiple system failures, and I want to highlight that we don't lack knowledge about how to treat the suffering that underlies suicidality. We actually have good data. We know how to treat it in the vast majority of the time. We know actually how to do good prevention work and early intervention work. What we lack are delivery systems, things that motivate us to get the things that we know out into the world to the people who need it. There are never going to be enough mental health professionals to treat the 17% of our youth who think about killing themselves every year. There aren't going to be enough of us, no matter how good our treatments are. We have to reach back and intervene earlier. We have to prevent that kind of suffering, not just treat it once it occurs. We've learned about the social and psychological factors that need to be addressed to turn the tide on this increasing rate of suicidality in youth. We understand how profoundly these problems affect individuals and families. We know how to help families. Good work's already been done to give us hope that we can intervene early. We know how to build skills in our youth, and skills create choices, and choices create empowerment. The problem is that we just don't know how to deliver these to as many people who need them. Families, schools, neighborhoods, communities, we all need to take an active role. We need to build new delivery systems from scratch. We need to figure out how to do this wholesale in our now entirely wired-in Wi-Fi world. We've got to build both three-dimensional real-person networks and systems and virtual electronic networks and systems to increase social and psychological skills. The old ones that we know are needed but aren't necessarily automatically taught any longer because the world has changed, and new skills that are needed to succeed in the modern world. Local, state, and federal governments need to support and help mitigate the unforeseen and indeed unintended consequences of many of the otherwise positive forces of modernity that have such a negative impact on some of our youth and their families, being disconnected, alienated, hopeless, isolated, stigmatized, and alone. We have to replace, and together I believe we can replace, hopelessness and despair with hope, isolation, disconnection and loneliness with community and connection, powerlessness with effective psychological and social skills, and stigma instead with understanding,